Norma Faraone-Ledgard of the Rhode Island Counseling and Hypnotherapy Center. And today I'm going to be giving you a brief demonstration of what happens when a person experiences neurofeedback. And I have my volunteer Ken here today. And what I'm holding in my hand right now are some senses and leads that soon I will be attaching to his ears and the top of his head. Okay, so you're going to see that it's a very, very simple and easy process to go through. My training in neurofeedback comes from Biofeedback Resource International Corporation. And my double doctorate is in clinical hypnotherapy. And there's sometimes when a person comes in with high anxiety or post-traumatic stress disorder or pain disorder, I may interject a combination of clinical hypnotherapy and neurofeedback. And that really helps reduce the anxiety and pain level. So with that said, I'm going to now begin to prepare Ken for his alpha training. This is called New Prep. And this is just a cleansing that goes in the sites that I'm going to apply. We cleanse and just a little smidgen more. Now I use what's called a 20-10-20 system. So we measure it from one top of the ear to the other top of the ear, and we bring our fingers together in alignment and we make a little cleansing there. All right. And here we have a little bit of the conductor gel. I'm going to grab the loop of the bottom of your ear here and just light, gentle squeeze. Explain how that feels. I'm going to prep the other one.
I guess it feels like an earring would feel.
Okay. Not too much pressure on your earlobe?
No, a little slight. I feel it.
Right. And the last prep is this is the one that's actually going to be reading your EEG of what's happening in your brainwave right here, right now in real time. And it's going to help register in the computer. And then we're going to be working with some computer programs called neurofeedback protocols. And what I'm going to do is I have my site that I've already prepped. I like to put a little piece of gauze and then press down. And what we're going to do now is a pre-assessment to gather in just the information of what we're dealing with right here, right now. So it will help me formulate the protocol for his neurofeedback training. And I'm going to what's called the EEG baseline pre-training. And we're going to hit start. Now, Ken, I don't want you to move, talk. I just want you to feel relaxed. And I want you to look at the screen. And right now, this top line, this white top line, is taking in your raw EEG. What's happening in your brain right now. Okay? Now, the next thing that's automatically programmed from the computer is it's monitoring your delta theta wave. That's the pink. Then at the same time, it's monitoring your alpha wave, how relaxed, attentive you are. And then the beta wave is the blue, basically your activity. The first wave is your raw EEG. So the computer's trying to get all this information about you, what's happening right here, right now. And then from this wave, it's tearing apart, so to speak, the different layers of all of your brain waves. But it's only showing you 3 levels of the brain waves, but there's many more than that. It would be too cumbersome and too confusing if we did every single brainwave that we have. It's going to take out from this raw EEG what your theta wave looks like, what your alpha wave looks like, and what your beta wave looks like. And at the same time, that's too confusing. They give us a little picture. I want you to see, if you opened your mouth really wide, look what's going to happen, how sensitive it is. Oh, there's your mouth. And I'll close it. Okay? So it's when you blink, it's going to pick up something. If you cough, if you sneeze, any movement, it's super sensitive because any movement you have registers in your brain. So if you come in with anxiety and your muscles are really tight, we're going to see. So make your fist, make your shoulders really tight. Look at what's going to happen in a minute. Okay? See all of this increase? Mm-hmm. Okay, that's you with tight muscles. Relax. Oh, look at what happens now. Everything kind of calms down. Okay? So I'm going to continue to look at your raw EEG. I'm going to look at this graph to see where are we going. This is your preliminary. This is pre. We're going to do a theta alpha training. That's just the name of the protocol. Alpha is to help you relax, so we're going to increase that. And then what we're going to do is 5 sessions, collect all of that data and trend it and see where do we begin and where are we 5 sessions later. And we should see a great improvement. And not only seeing it, you'll be able to feel it. Truly try not to move, talk. If you need a break, even though it's 2 minutes to some people, especially when you're anxious, seems to be a very long time. So if you need a little break or if you need a cough, just let me know and I can pause it. Okay? Dual monitor system is one monitor, has the same data in the raw data that I'll be looking at on my computer. His job is to look at this monitor, and what it's going to do is says stay relaxed but awake and keep the animation running. The whole point is the more relaxed you allow your mind and body to be, you will be changing the animation through the power of your own mind and the power of your own concentration and working the brain waves. Isn't that fabulous? And there's no stimulation. He's not getting any stimulation from me. You are working with your brain waves, your focusing, and your concentration to make that happen. Now I'm going to say one more thing here. If you are highly, highly anxious, and a person is really, really anxious and really having a hard time relaxing, now this, before we do the training, is where I would implement my clinical hypnotherapy. And I would take a Brinnet, I would lead them through a very small session of hypnosis, really get that mind relaxed and get the body relaxed, which will help you relax to make then your neurofeedback session super. Okay? Doing your post assessment. And I do a pre and post after every visit. Just like the pre, we're not going to talk, we're going to try not to move, and we're just going to collect the data for about another 2 minutes. Now your curiosity would be, Ken, is looking right here. This is very simple to look at. When we started right here, which would be your delta and theta area, was higher, right? Now we relaxed you, and we didn't relax you very long, but imagine relaxing for 30 minutes. Now look at how this is the alpha area. We want that increased, and we want the delta and theta decreased. We already have a little bit of a result for you. Post, I'm going to be continually looking at the raw EEG. My eyes are continually on the graphs that I'm looking to see where his peaks, what has changed from the pre to the post. I'm looking at his alpha area. Right here, if you can see the arrow, that's the alpha area that I want that increased a little bit. And this area right here, the delta and the theta, I want to continue to work on getting that inhibited, meaning decreased. So the rewards will be in the alpha area, and the inhibits to decrease will be right here. And all of this on this end, from this part of the graph down, you're working beta and gammas, and that's a lot of activity issues. Now we're at the end. The program is done. The neurofeedback training has taken place. Ken, do you have any comments that you would like to share that someone who's never experienced this before could now comprehend what it's like?
It's pretty relaxing. Didn't feel anything from the leads, and almost fell asleep a couple times in the training.
Okay. Would you recommend it?
Yes, absolutely.
Okay, great. I did have one person that I trained that was an athlete who wanted to increase their speed and their ability to perform the skill and better, and I was able to help them increase the beta and the gamma, and they did a wonderful job on their activity. So that worked out well. So neurofeedback is used for a gamut of issues. while I mentioned some names, I have no contract or obligation. They're just wonderful pieces of equipment that I've researched to use, and I make no profit out of talking about their names.